Hi, I'm Allison, and I am a physical therapist. I work for South Texas Spine Clinic, and I've been asked to demonstrate some exercises for lower body strengthening. When exercising your lower body, it's always important to use the proper intensity, the right amount of repetitions. Generally, with my patients, I tell them to try for 2 sets of 10 repetitions. If that's too easy and they feel like they could do more, go on to 3 sets. And if that's not enough, you need to talk to your physical therapist because they can tell you what exercise needs to be done, or you may not be doing it correctly. The first exercise is just a general stretch. All of us tend to sit too much, way more than we need to, so we're going to stretch Ms. Nora's hamstring right now. She's lying on her back. Always have one knee bent to protect the spine. And Nora, you can reach around and grab the back of your thigh right there. And 2 minutes a day is what it takes to get an actual change from stretching your muscle. So she's going to count to 34 times, and that'll give her a good stretch and actually some change in her hamstring length. The next exercise she's going to do is a really nice one if you sit all day or if you just kind of wake up stiff. She's going to grab her knee and just pull it to her chest. She should feel a stretch in the glute, the back of the hip. And if this isn't enough, she can straighten this leg, straighten it all the way down so that she stretches out the front of the opposite thigh. And again, hold for about 30 seconds. Repeat that 4 times a day. The next exercise she's going to do is a hip strengthener. This is called a clamshell. So she's just lying on her side, back is completely straight, and her heels are glued together. Now, Nora, I want you to lift up your top leg like that. Perfect. And do a few repetitions for me. What a lot of people tend to do, and this is cheating, they do this, and they rotate their back, which is going to hurt the spine and not work the side of the hip like we want. So don't do that. And just keep lifting. Perfect. And again, 2 or 3 sets of 10. And if you need more, you can always add a resistance band around the knees. The next exercise is just the opposite. She's going to keep her knees together and lift up her foot. A lot of people forget to work this muscle in the hip, and they start to kind of waddle when they walk. So this is a great one for hip stability. So the next exercise that I'm going to have Nora do is a good little squat. It's going to help strengthen her quads and all of her legs, really. And for this exercise, I like to tell people to have a chair behind them in case they lose their balance and need to sit down. So your feet are hip-width apart, and you're going to act like you're going to sit down, but don't. Perfect. And I like that your knees are staying behind your toes, your shoulders are over your knees. And I'm just giving a little bit of cueing for Nora right now. If you're at home and you're trying this, make sure that chair is behind you, and if you squat too deep, you just sit down. As you get older, one of the first things to go is your balance, and with that goes your ankle strength. So these are 2 really easy exercises that you can do at home to get your ankles a little bit stronger and help you with that stability. So the first thing that you're going to do, you're holding onto a chair or a counter, something really sturdy, and you're going to do a heel raise. So stand up on your tippy toes as high as you can go, and then slowly come back down. Good. Again. And a lot of people have to work up to doing about 30 of these, so if you have to, that's not a problem. Again, your ankles might have gotten weaker and you didn't know about it. And then the next exercise is going to be toe raises. So you're standing up nice and tall, your toes lift up off the ground, and then back down, and back up. And one of the things that people will do to cheat with this one is lean back. Instead of using their ankles to do the motion, they just lean